Hi, everybody. My name is Dr. Rebecca Cisneros, and I am a OB hospitalist with OBHG. I have been with OBHG since 2019 when I graduated residency in New York, and I have been working with them ever since. I really enjoy my position, really enjoy the patients I get to work with, and just the lifestyle. Currently, I'm working in Colorado, and I've been here for about 3 years now. And today I just wanted to share my life save story with you guys that I had on one of my shifts while I was on call in the hospital. First off, I want to start by laying the groundwork for why this was a life save story and why this kind of happened. Our hospital in Colorado has started an initiative for whole blood administration to be given in the field by emergency medical services. I think this is starting to become an initiative in a lot of states, and typically this is used in situations where there's massive hemorrhage involved, typically in the military, where they need to administer whole blood as a life-saving measure. It's very interesting because whole blood is already in a one transfusion state. They don't remove anything from the blood, so it has everything the patient would need in order to better survive. It has the red blood cells, the plasma, and the platelets. I actually wasn't aware that this was going on in our state until a patient presented to the hospital in need of this very necessary life-saving measure that was given to her in the field. So this patient came from home. Our patient population is very unique because we do have a lot of patients who attempt home births or try to birth at a birthing center other than the hospital. So I think this is very important for us to have, especially in our community, because we do receive patients who may be a little bit sicker or just need a little bit more help whenever they do present to our hospital. So this patient was at home planning home birth, and she was laboring. At some point, her water broke and she started to experience a massive amount of bleeding. She called her midwife, who came to be with her, and they immediately realized that this was more bleeding than was normal for pregnancy and labor, and they ended up calling emergency medical services. When the EMS arrived to her, they immediately called the hospital, letting them know that this patient was on her way and likely she was having an abruption. When the patient got to our doorsteps, we greeted her in OB triage, and to my surprise, she already had blood running, which was awesome because by that time she had lost a little over probably 1.5 liters prior to even coming to the hospital. So, what could have been a more serious situation, a more emergent situation, whenever she immediately came to the hospital, we were able to kind of take a breath. Baby was doing good on the monitor. Mom was doing okay, even with the amount of blood that she had lost. The fact that they had already started that blood transfusion really helped mom and baby better stabilize in order for us to evaluate her and move to the OR and proceed with a more emergency section, but not a crash C-section, which, we all like to do things under more calm situations. So this is the first time that I saw this happening. And when I asked the nurses, they were like, oh, yes, this is an initiative. And she's actually one of the first patients that I think received blood in the field from them starting this initiative. So it was very valuable for our patient. And in this situation, not only did it save one life, but it definitely saved both lives, mom and baby. So, like I said, I've been a hospitalist since I graduated residency in 2019, and I just kind of fell into the position whenever I was looking for a job after residency. But since then, I've really enjoyed it. The services that we provide to the hospitals that we cover, I think are, I can count more than a handful of times where there has been no other provider in the hospital. Either the nurses can't get a hold of the provider's doing another case, or they're stuck in traffic and their patient comes in an emergent situation and needing, immediate care, and there's nobody in the hospital. So we're the ones who are there when that does happen, and we provide an invaluable service to these patients. And I really do think we do decrease the maternal morbidity and mortality and have better outcomes for mom and baby. Just because we're on site, we're there 24/7, and we provide immediate service for anyone who comes in who may need those emergency services. Like everybody knows, in OB, minutes are valuable. 5 minutes could be, everything for baby, whether baby ends up in mom's arms, happy, crying, or whether baby ends up in the NICU in a cooling blanket. So for us, the services we provide are invaluable. And I really do believe in what we do as a group. And I've been to hospitals where they don't have OB hospitalist programs. And really quickly, I recognize that they really need these services because their patients are just more high risk than they realized, or the providers just aren't immediately available, or the nurses can't get a hold of them for whatever reason. And we're always there, to deliver that baby, to help that mom, and to have a good outcome for both mom and baby and a happy family at the end of it.